18.2 Physiological responses. One of the first response that you will get is pain and swelling. Your body does this to protect the injury by swelling. This restricts the movement to reduce the damage you do if you carry on when injured. When you see swelling, you should stop, as it's your body trying to tell you that something is wrong and that you need to stop. Damaged tissue, different types of tissue that can be damaged. Muscle tissue, contraction and movement. This can be a pulled hamstring, bone, a broken bone, a ligament, sprain and ligament in your ankle, and tendon, pull a tendon. Primary damage response. 3 to 5 days, sharp pain, swelling. This will be quite quick after the incident. The injured area will start to swell up to reduce movement in the area so you cannot move it properly, and this should stop you from playing/participating in whatever you're doing. Rice, you need to apply rice straight away to reduce the swelling and redness in the injured area. Rice stands for rest, ice, compress and elevate. You'll get bruising and possibly bleeding. Healing response. Muscle fibres grow from cells in the muscles. Regenerate muscle fibres, increase blood flow to heal. You can do hot and cold bathing to do that. Scar tissue is when the tissue forms in between. Bleeding from the muscular causes scar tissue. The clotting mechanism. When you bleed because of an injury, the blood clots to start the healing process. Platelets cause a clotting to stop bleeding. They are the cells within the blood. This is caused by a chemical reaction, which when injury occurs, these platelets cause the blood to become sticky and cause a clot quickly, and they stick to the surface of the blood vessel. Clotting is an important part of the preliminary phase of healing. Fibroblast. The importance of scar tissue control in the remodeling process. This is the development of scar tissue. Restore tissue where the injury happens as closely to the original state before the injury. When the injury happens, scar tissue starts to reform. It is vital that the right treatments are applied to regain the same amount of original function before the injury happens. So when you get injured, making sure that you get the right physio to make sure that scar tissues go back to how they were originally, otherwise they won't go back to their original state. The worse the injury, the harder it is to restore the damaged tissue back to its original state, so the higher grade injury you have, the harder it is, so the better physio you need and the more physio you need. Specific to injury, sprain/strain, and these are going to be the signs and symptoms of the first, second and third grade injury. So the first grade, this is the lightest injury you can get. You won't be out for too long. The pain won't be too bad. It will be a mild pain, much less than the second or third grade injury. There might be a popping sound when the injury happens, and you'll find it difficult to move the injury, and you could get bruising. Second grade injury, you'll be out for a little bit longer than the first one, but not as long as the third one. The pain will be more than the first injury, a mild pain, but a lot less than the third injury. There will be more swelling. There will be a popping sound when it happens. You might be able to hear that. It'd be much more difficult to move. There'd be more bruising, more redness. It would be harder to walk on. You might find yourself having to hobble a limp because you can't weight bear at first, or you can only slightly weight bear. The third grade injury, you'll be out for a lot longer. This is the worst injury you can have. This is the worst grade injury you can have. The pain will be considerably higher than the other two. It'd be a very high pain, something like breaking a bone. You'll get a lot of swelling and be very swollen. You won't be able to see the part of the ankle, or say if it's an ankle injury, you won't be able to see it because it'll be so swollen. it'll be extremely bruised, like a dark purple colour. You might be able to hear the popping sound when it happens. You won't be able to walk on it, and you won't be able to move it hardly. Hematoma, inter and intra. This is a collection of blood in the tissues and cavities. It's seen as bruising of the skin. It is caused by internal bleeding in extra cellulars, intermuscular hematoma. Bleeding occurs within the compartment of muscle, but doesn't go to the surrounding tissue. Intramuscular hematoma. Blood escapes into the surrounding muscular tissue. Describe the physiological response includes the relevant parts in the following. Response to injury, anxiety. So during the time of your rehabilitation, you may become anxious because of the amount of time it is taken for you to recover. Then the person might think and feel that they won't be able to recover to how it was before the injury. Depression. This can happen when you get injured. This is normally to people who have played the sport for a very long time and know nothing else, and have got a bad injury as well. They may lose motivation to do anything, which will affect them socially. Isolation from teammates. When players get injured, they can become isolated during the rehabilitation. This can affect them psychologically as a player. They will start to feel like they're not part of the team. This normally happens when the injury is more long term, and they feel like they won't be part of the team when they get back to playing. Response to treatment and rehabilitation. Frustration. Players who get injured will go through this during their treatment, as they will want to play and they cannot, and they will start to crave competition because they're not used to not being competitive in the sport. Need for motivation. When players get injured, they may lose motivation. To make sure they don't, they can goal set so they have something to work towards. So because if you have a long-term injury, you'll find it harder to have motivation the whole way through, especially if you don't it doesn't go as quickly as you think it should. So goal setting is a good way to slowly and gradually reach small goals, but it will motivate you to want to reach them goals. Use of goal setting during injuries can keep players motivated, as it keeps them thinking about achieving their goal. It gets them to work towards something. So each week, if you set yourself a goal, then you're looking at achieving the goal for that week, not the overall goal, and it won't seem as bad and as long if you during your injury. Analyse the physical responses to most sport injuries. Okay. What if the athlete responds negatively to isolation? So if an athlete responds negatively to isolation, then this will affect the player psychologically. The player will start to feel like they're not part of the team and feel like they aren't part of the team. When they finally get back to training, they feel out of it, and it will affect them socially as well, as they won't feel like part of the team, so socially will find it hard to go back to the team. This will affect their future career because socially they don't feel part of the team. This could affect their performance. They might feel like they're not good enough to be in the team, and this will show in their performance. It also could affect their training because they're socially they don't feel part of the team, so they don't have the motivation. It affects their training session, then it affects them actually getting time to play because they're not showing themselves in training to get time on the pitch. This is dependent on the severity of the injury, because the shorter time that the player is injured, the less isolation they'll feel. So if you're only out for like 2 or 3 weeks, you might not even feel it at all. If you're out for maybe 2 months, you might start to feel it slightly. But if you're out for like 6, 7, 8 months, then you'll feel it a lot, because you won't feel like you're part of the team at all, because you might not even know some of the players that you're playing with. This will make it much harder for people to go back. How will the athletes react physiologically if they are not meeting the recovery targets? Will this incur setbacks? If the player isn't meeting the targets, they will feel down because they cannot see how they are going to get better. They might end up being out even longer than they would have been. This will affect them psychologically, as they will feel annoyed at themselves for not being able to hit the targets. They may get frustrated because they aren't where they want and think they should be. This will affect them especially if they feel like they can't do any more to reach the target. They might feel like giving up. They don't know how they're going to get back to full recovery. When coming back from injury, especially if it's a long-term injury, players can get setbacks and can get reoccurring injuries and get like different injuries. This will be very frustrating for players. They feel like they've just got past the injury and are so close to getting back, then suddenly they're back to square one, having to do it all again, and might lose motivation as they won't see how it can get better. So during rehabilitation, it's a lot of players will get setbacks, so they're almost back to playing again, and then they do a training session and they're actually get the injury again, so that they actually have a reoccurring injury. So they've gone from in one training session almost being back to training fully to actually back to square one and having to go through the whole process again. Like you can see how it's quite easy to lose motivation, because you don't see how that you're actually ever going to get back, because you're scared of it then happening again. And that's more in long-term injury as well, because the longer you're out, the more the chance there is of you having a reoccurring injury. How can the athlete use rehab time to improve themselves? Maybe a plan B, or improve physically. Rehab time can be used to improve yourself. For example, if you have an injury in your ankle, but a weakness of yours is strength, like upper body strength, in your rehab time, while you're getting your ankle better, you can actually do like upper body workouts. So you can do weight training and exercises that just use your upper body and have like, you don't need to use your ankle this way. Although you're injured, the good part about it is that you're improving something that you may not have improved when you get back. So when you actually get back, you'll actually get back much better, because you won't just be back from injury, but you would have improved something that you might not have improved if you hadn't have been injured. So it's about like looking on like the bright side and trying to work on things that you might not have been able to or might not have done if you hadn't have been injured. Also, it's a good way to motivate yourself, because you'll see yourself getting better at doing something else quickly. So you'll feel like if you put the time and effort in with with the injury that you have, then you'll get back to injury, and you may not lose motivation because of it.